It's my pleasure to introduce our next speaker, who is Stacy Dralle, who comes to us. Our education went through Rochester Institute of Technology and then on to Ohio State University. She's a veterinarian here in town in Orchard Park Veterinary Center, Medical Center, and it is a wonderful vet clinic if you're not familiar with it. And her own specialty is increasingly in feline medicine and also in exotics. Dr. Dralle.
Thank you for having me here. It's been such a wonderful opportunity to be here and listen to everybody talk. I've learned so much and just thankful to everybody for letting me be involved. And I'd like to talk today about managing cats in the veterinary setting. So I think that as I've listened to these talks, we're going to be kind of reviewing quite a few things, some recurrent themes that kind of goes across different aspects of cats. The main resource for this is the American Association of Feline Practitioners and the International Society for Feline Medicine Feline-Friendly Handling Guidelines that was published in the Journal of Feline Medicine and Surgery in 2011, in case anybody has any further interest. So these are my two cats, Wally and Cinderella, and I have no problem admitting that I love these cats more than I love my husband. So they will be here throughout the presentation, so you can expect them to show up. So I know we've seen a lot of these facts and figures. These are from the Cat Friendly Practice website, but basically, we know that there are more cats than dogs. However, cats are far less likely to be taken to their veterinarian than dogs. In fact, almost twice as many cats as dogs never visit the vet, and of those that do, 26% fewer visits than dogs. So, and even if people are taking their cat to the vet, 39% are only going if their cat is sick, and 41% only for vaccines. So why aren't cats going to the vet? 60% of cat owners report that their cats hate going to the vet. And obviously that's a perception of stress and anxiety for the owner. It starts with them having to get the cat into the carrier at their house, a crying cat in the car, a noisy reception area, an exam, handling. Sometimes if their cat is sick, needs to stay in the hospital. And then when they go home, sometimes they're given a bag of food or medications or said you need to do this or that. And it's all this changes that they're not accustomed to. I didn't put costs on here, but we kind of touched on it briefly earlier. Obviously, costs are a big concern for people as far as going to the vet and taking care of their cats, especially if there's some chronic disease that needs monitoring. So why is it important to establish or to encourage routine veterinary visits? By establishing effective veterinary client-patient relationships and educating cat owners, we can teach them measures to reduce stress and sickness in the future, and also how to identify changes in their cat's behavior that might indicate that they're sick. I think that cats are very good at hiding when they are sick, and since they're living longer, it's important for us to institute routine care like preventative medicine with vaccines and lab work, monitoring weight, trends like that, so that we can help maintain them having a good, long quality of life in their houses. So the goal is to improve the veterinary experiences for the owners, the cats, and the staff members. Through understanding feline behavior and ways of interacting with cats, that management can be adapted to each individual cat. That's not Cat Wally. So this is obviously learning to recognizing signs of feline stress and anxiety. So while these are just a couple of pictures from the internet, this first cat's obviously pretty stressed. Its pupils are dilated, its ears are back, it's not comfortable. Whereas this other cat, its ears are forward, it almost looks like it's smiling, it's interactive. So while feline behavior is obviously on a continuum, most cats are going to be somewhere in between these two. Through training and experience, you're going to learn to recognize when a cat is stressed or might be becoming stressed. And based on what I've read, fear is the most common cause of feline aggression. So by learning how to reduce stress and fear, we're going to make sure cats are more comfortable and able to work with. So for management in the veterinary setting, it actually starts at home by getting a cat into the carrier. An ideal carrier is something like this, like a hard top carrier that the top can be removed. And in a lot of situations, you're trying to get the cat into the carrier and trying to force the cat in, and it's not a good thing for you or the cat. So by placing the carrier out, this is just my cat Wally at home with the carrier. I know it's not a very good picture, but there's a toy in there. So making the carrier something familiar to the cat, you can put treats in there using positive reinforcement and behavior modification techniques to make the carrier a happy place for the cat, so that when it's time to go in the carrier, it's not something that adds stress to you or your cat. The car. So temperature control, here in Buffalo, it's winter, it's very cold, and summer it's very hot. So cats are very sensitive, so making sure that the car can be either air conditioned when it's summer or warm in the winter. The carrier should be placed in the front seat with a seatbelt or on the floor. Trying to acclimate a cat to car rides at a young age will help. So even just 10-15 minutes, don't have to end up at the vet, can help make sure that they're more comfortable in the car and they're not crying. Fasting 3 to 6 hours prior to travel can help prevent nausea and vomiting. So this is just a carrier with the seatbelt in the strap, and then again just on the front seat of a car. I like that picture too. Once you get your cat to the hospital, the ideal reception area would be quiet with the ability to separate yourself from other cats or dogs with an elevated space. Cats do like to be up, and cats have stronger senses of smell than us, so free from a lot of odors. One of the participants out here did come up and ask about the use of rescue remedy and had some questions, and feline pheromones is something that we can potentially use in the hospital setting. So I will talk about that just briefly, but Feel-Away is a synthetic feline pheromone that mimics that which cats make for marking territory as safe and secure. And its goal is to help reduce stress, and it can help in cats with a variety of issues like during transport or hospital stays, also lower urinary tract diseases. There is a nice little video. I was going to maybe show it if I think we have a minute. When I was kind of going through it, kind of shows the dramatization of what our goal is and how people tend to experience when they go into the vet with their cat. So just watch it for like a minute.
Believe it or not, I wasn't always the sophisticated, self-assured cat I am today. You see, that's me in my formative years. Nervous, uncertain, anxious. I'm not gonna lie, there were times when I was scared as a cat in a room full of vacuum cleaners, especially when it came to traveling. I never wanted to leave the comforts of my home. And sometimes I was even frightened of things in my own home. It's true, I acted out on occasion, or two, and I wasn't really keen on crowds either. Some would go so far as to say I lacked social skills, but I would disagree. I wasn't a bad kitty. I was just a bit lost. Like, one of those poor little hamsters trapped in an endless wheel of despair. Oh, until I discovered Feel-Away. It's like pure happiness, all wrapped up in a convenient little package. It's amazing how something so simple could have such a perfectly profound impact on my life. Which is why I now feel compelled to share my secrets with other troubled tabbies and fret-filled felines looking to make their journey through life a little bit more relaxing. Of course, I still know how to have a good time.
All right. So I just thought that that was kind of interesting. I mean, wouldn't it be nice if cats just walked into the carrier, closed the door, and took a nap on the way to the vet hospital? Feel-Away is not something that's going to mean that you don't have to work and do behavior modification, but as a component of a multifactorial thing, it may be quite helpful. So I just kind of wanted to show that. This is
To heck with the cat. I want some of that stuff.
This is the reception area at the Orchard Park Veterinary Medical Center. We see cats, dogs, exotics, so a lot of traffic in and out through here. But in the next slide, you can see this is one of our technicians, Adrian. She's just here with my cat. Cinderella is in the carrier. We've elevated her off the ground so that she's not kind of where a lot of things may be going on. The door's over here, so we're away from the door. There's a divider here. There's no other cats or dogs around, so kind of trying to limit the nervousness and exposure that she might experience. Typically, when I do an exam, I realize now that black cats don't make the best pictures, but this is one of our technician's cats, Shadow, who is actually in the carrier right now. And the door is open to allow her to exit on her own. So usually when they come in, the carrier is either on the ground or the table, and I'll be taking a history. And if the cat will exit on its own, that's obviously the best case scenario. If a cat won't exit on its own, those removable top carriers, the top can usually be removed, and the cat can stay in the bottom of the carrier with the owner standing there. Also, sometimes a table or a cloth or towel can be placed over the cat, just as another added security feature for the cat, so it feels like it's hiding. So typically, I also usually keep a little toy on my stethoscope so that I can throw it on the ground for cats to see if they want to play and bat around with it, but I think that's just me. I usually start at the head of a cat and do my exam there, and then turn it around so that it can face the owner away from me and towards the owner. For some cats or people, moving to a bench or away from the table makes them a bit more comfortable. In either situation, I'll go back a second, there's a towel or a pad on the bottom so that cats feel secure, have some sure footing. So even in the best of circumstances, some general restraint's going to be needed. So the goal, though, is obviously that we reduce the risk of injury to our staff members and to cats. Cats could potentially do some serious injury with their teeth or nails, but it is typically a last resort for cats. So in this situation, Maria's cat needed some blood drawn. It was not very stressed, some minimal restraint of the head and neck, and we were able to draw some blood. Other techniques would be a towel around just a towel. She's hiding under the towel so that she feels like she's not stressed. Some cats that are trying to lash out or maybe even bite might need a little bit more restraint, so a towel around the neck. This is a cat bag. A lot of cats, you're going to have trouble getting into the bag, but if they do want to go into the bag, and this is Cinderella, she actually didn't mind it, and then there's a zipper, and you can potentially pull their legs out for blood draws or catheter placements. So one thing I didn't show was scruffing, which might be something that some of you are familiar with. It's holding the skin or fur around the neck. It's a natural behavior that occurs at a young age when the mother will carry kittens and during mating, but it's largely gone out of favor as a form of restraint. Other options for cats that require some additional restraint and are nervous might be splitting procedures and having them stay for the day, or the use of mild sedatives or tranquilizers if needed. So just like in shelter situations, if cats need to stay in the hospital, a cat-only ward separate from dogs where that are barking and the lights can be turned off or the door closed if necessary. A towel can be placed over for cats that like mentioned earlier, don't like a lot of traffic going by their cage door. There should be a hiding area, separate litter box, elevated off the ground, feeding schedule, ideally as consistent as possible for cats to reduce the stress of a new environment. So when I brought, again, there's actually a cat in here in the back. I've just used the carrier as a hiding place in this picture with her own toy, food, litter box, and then again down here, a towel from home. Even something like a cardboard box works just fine as a hiding area. It doesn't have to be anything fancy. So whether a cat's there for the day for a veterinary visit or it's had to stay in the hospital for several days, returning cats may carry different odors. And if there is a multi-cat household where aggression is an issue, then consideration for reintroduction should occur. And if medications or diets are prescribed, then adherence to directions is important. So communication with cat owners about what to expect when going home so that when they come back for their recheck a week later, you don't learn that the cat hasn't been getting its medications because they couldn't give it. In summary, cats are obviously pretty popular pets that aren't receiving appropriate veterinary care, and being feline friendly means taking efforts to reduce stress and fear for our feline patients to make the veterinary experience a positive one for everyone involved. Some other resources in case anybody wanted to know how to get their cat to the vet. So, thank you.